Thank you very much for the invite down to come and join you. I did cut it very fine this morning, as you appreciate, up from the north of England, so I couldn't resist the opportunity for a game of bingo this morning to come in. I'll be saving a few pence on a few pints later as well, but there we go. But I've been asked to start the conference off by giving something about the sort of challenges facing the NHS and where the AVR may fit in to some of those challenges. So it's sort of a big ask, really. You know, where, in terms of looking at the NHS at the moment, where do you start? You know, where do you start with looking at the challenges that we face? And I think we start with compassion. So compassion, just roll that word around in your mouths for a moment. Compassion. I think it's a word whose nearest neighbour is love. It's a word that demands an emotional reaction. It's a word that we want to hear when those around us are receiving care. And I think it's probably a word that's been said in the NHS more times than any other in the last year. But therein lies part of our challenge, because in repeating it in the last year, it's nearly always come after the words, a lack of compassion. So we've got just 4 words that in this last year have been used to describe the institution we work in, the institution I've helped build and feel part of, and the institution that I work in and I'm a part of today. And I know that doesn't tell the whole story, not by a long shot. And in fact, it's really hard right now to engage in any mature debate about the NHS. On the one hand, if you talk about the challenges facing the NHS and the big task of work that needs to be addressing, you get accused of, undermining a well-loved institution for some form of political gain. On the other hand, if you talk up the remarkable and wonderful things the NHS does day in, day out, those stories that you'll hear from friends and colleagues when you go out to meet them, if you talk those up, then people accuse you of naivety, so you don't really understand the problem, and in actual fact, you're part of the problem because you don't really get it, do you? And that's the sort of challenge that we face. It's sort of lose-lose. And as a result of that, we've ended up with a sort of parody of managers that are portrayed as pantomime villains, and that employers that are just trying to sort of hold people down. And we have to show that we are just as passionate, just as committed as are our clinical colleagues to delivering that safe, high-quality care within the NHS. We have to show that is the authentic voice of the NHS. And there are some, really remarkable achievements that we can be proud of. Cancer survival rates have doubled in the last 40 years. Premature deaths from heart attacks have declined by about half in the last decade. And we see year-on-year reductions in those mortality rates that get so much press coverage, but year-on-year reductions in those mortality rates. But we know that unless we acknowledge that story around mid-Staffordshire is true, we know that we can't begin to appreciate the size of the task that faces us or the wealth of the opportunities that creates for us. And it was shocking, wasn't it, when we sort of looked at that stuff? It still feels shocking today. I don't know if anyone knows the story of Shoeless Joe Jackson, if you want a sort of shocking story. So Shoeless Joe Jackson was a baseball player at the turn of last century in America. He was sort of big at the time of Babe Ruth and those sorts of things. In fact, he was the hero running up to Babe Ruth. He was idolised. He never learned to read and write, and he played without shoes, hence Shoeless Joe Jackson. I guess he was the David Beckham of the baseballing era at that time. But in 1919, when he was playing for the Chicago White Sox, he got involved in a match-fixing scandal in the World Series. And he and 7 other players got charged with match-fixing. And it was the headlines. The headlines covered this enormously at the time. You can imagine that sort of scandal, if it was to happen now around the sort of David Beckham-y type stuff. And, the press followed it very carefully. And when the court case was concluding, the crowd was sort of gathered out in sort of 1919. And Shoeless Joe Jackson comes out of the courtroom, and there's a young lad right at the front of the queue. And he shouts out, "Say it ain't so, Joe. Say it ain't so." He couldn't believe that his hero, his idol, had been caught up in this scandal. It was just incomprehensible to him. And I think for many of us, the stuff when we read about Mid-Staffordshire is the same reaction. Say it ain't so. Tell me that didn't happen. Tell me we didn't have people lying in their own feces. But it was so. It was so. What's been, I think, impressive and heartening since that second Francis report is that huge amount of energy that's been given into every aspect of the recommendation. So whether it's about leadership or recruiting for values or skills for staff working with older people or raising concerns, the system has come together to try to address some of those. There's a real commitment, I believe, to learn from Francis. And this is really encouraging because in considering each of those 290 recommendations, we can look at them and tick them all off as we sort of work our way through them. But we do need to keep a focus on that critical challenge that faces the leadership community, that challenge of creating that sort of compassionate organisation that we want to be part of, so that every ward, department and clinic, every time a patient is visited at home or attends their GP surgery or journeys in an ambulance, so that our patients experience the best the service can be each and every time. And I know that's challenging and it's aspirational, but it's absolutely the right ambition for those that use our services. In many ways, that culture thing, I sort of come from an HR background. It gets talked about as sort of soft HR. The hard HR is about organisational change and job restructuring. This is the soft HR. But the problem is we don't have a choice of whether to do the soft or the hard. We have to do both. We have to do both to do that. And what we'll be judged on in the NHS is how did we respond to those challenges that we face. So did we have the humility to accept our part in that? Did we have the bottle then to face up to it? And did we have the skills and responsibilities to do something about it? Not just action plans and business cases, but actual interventions that change things. One of the big challenges I think that we face in this is about the leadership task. We talk a lot about the leadership style we need in the NHS, but this is about the leadership task. And I genuinely believe that the Leadership Academy is doing some really good work on the style and type of leader that we need, and that our organisations are developing strong leadership programmes and grasping that nettle of the things that we need to do. And the NHS has continued to invest in those despite those financial challenges. But we have to be clear about what's the leadership task facing our organisations as well. We need to be clear that the job of chairs and chief executives, the leadership task that they face, is to ensure the best possible service for the people that they're serving, the best possible service for their local communities, and to meet the health challenges of today and, more importantly, tomorrow. Not just trying for organisational survival or just trying to tweak the organisational models that we've got today. So what's that got to do? What's that challenge and context got to do with AVR? I do believe we need that sort of clarity of leadership task, but I also need that we need to have less focus on the numbers. So less focus on the numbers. There's that famous quote by Einstein that said, everything that counts cannot necessarily be counted. And we've got a problem in that the quality of services in the NHS is now judged, in the media at least, on the total number of nurses that we have. The total number of nurses that we have. So if there's a story that nursing numbers have gone up, hooray, care is getting better. If there's a story that nursing numbers have gone down, boo hiss, care is getting worse. That's the sort of debate that we've got. And I guess sort of intuitively that makes sense, doesn't it? Sort of intuitively, it would be, it's my mum test. She would look at that and say, what are you doing, Dean, if nurses are going down? What are you doing coming in here? And I have to say, I think that there is a link between safe staffing and the quality of care. So let me repeat that for the avoidance of doubt, even if you're not quoting me, but anyone on Twitter. There is a link between safe staffing and the quality of care. But we certainly all know here, that good care, good public service is more than the absolute number of staff. We know that pathways and models of care change, and that needs to have a different skill mix and a different combination of multi-professional staff. Staff that make an enormous contribution to the care of our patients, whether that's OTs, physios, speech therapists, dietitians, community nurses, staff working in health and social care, as well as hospital nurses and doctors, and those dozens of other professions that provide so much care, like sort of healthcare scientists and the other sort of therapists, and the way that they sort of involve and engage with patients. But the story goes a little bit like this at the moment. You know, if you've got let's take a ward or a clinic or some sort of community function over here that's got good patient outcomes, and over time they've invested in multi-professional care. They've brought in sort of housekeepers and maybe play therapists, to come sort of help on that sort of ward and that sort of environment and that sort of care setting. They've got admin staff that are working in there so that the professional staff can spend more time on direct patient care. They have fantastic relationships with the speech therapists and the dietitians that are coming in and are part of the patient handover. And they get really good patient outcomes, really good satisfaction rates on it. And over here, you've got another setting that hasn't done that at all, hasn't invested in that sort of skill mix, but has got slightly more nurses. Now, at the moment, you look at that, and what the media would tell you is this must be better, because it's got slightly more nurses. I'm not trying to do nurses down here, by the way. I think they make a fantastic contribution, but we've got to have that sort of sophisticated debate. If we judge the quality of the service we provide on the numbers of one particular staff group, we'll end all that sort of innovation that goes on around our professional groups and multi-professional care. And I wish that wasn't the case, by the way. I wish it didn't work like that, but I've worked long enough in the NHS to know that that's how our bureaucracy works. If some figure materialises that gives you a number that people are aiming for, people will hit that number at no additional cost, but it will be at the expense of other professional groups. We've got to promote and show the value of the range of different groups we've got working in the NHS and the contribution that they make. One of the things that came out of Francis was that undue attention to hitting targets with that untold consequences. So let's learn the lesson at least about not hitting targets in one staff group at the expense of others, and certainly to the detriment of multi-professional care. So let's provide some robust evidence. Let's look at models of care. Let's look at the skills and contributions of different staff groups. Let's show that we're interested in CPD and the way that we can assure ourselves that those staff are doing a good job. Let's see how we can bring their expertise together and promote the contribution that they make. And then let's be transparent about the staffing numbers and the staff that we're bringing in and the roles that they've got and how we assure ourselves that they're providing good care. And that's where things like the AVR can make that difference. I think that the AVR enhances the public protection and raises professional standards when it's used well. It improves standards and safety for the benefits of the public, and we can show and demonstrate that. It can provide a layer of protection to anyone looking for health and care services that are not regulated by statute. It can provide assurance that the organisations that holds the register meets those standards. It gives assurance that the organisation's professional register is well managed and that the registrants are required to meet high standards of personal behaviour, technical competence, and it's also supported by employers. Generally, as employers, when you sort of look at it, it's not about that numbers and ratios issue. It's not about regulation per se, but it's about assuring ourselves that we've got staff that are sort of supported, and we've got confidence in what they're doing, the practice that they held, the standards that and they're held to account in some way. And I speak to that as a sort of HR professional. I'm a member of the CIPD. I don't have to be a CIPD member to do the job that I'm doing. But when I look around in organisations and I look about whether people are part of a professional body like the CIPD, because I know that it holds them to account. I could technically get struck off for not doing them. It doesn't mean I would necessarily lose my job on that, but I think that is important in terms of having a look at what we do. And we've got to sort of show, that we can look at those sorts of registers in a way that it, isn't just always about regulation and numbers and ratios, but about what it says about the standards that people are occupying and the quality of care that they're delivering. So why is it important that we get that right? Why is it important that we get that sort of context right in multi-professional care? I believe that when I believe that the NHS is the fairest healthcare system in the world. That when it operates at its best, it has the highest standards in the world, and I want more of that, and you want more of that, and our patients want more of that. And why I say this is important for employers and managers as well is because sometimes we get sort of presented as, the sort of grey-suited brigade, not really understanding the sort of issues that face. But as professionals, we of course want to use our skills to do that, but we're also members of the public. We've got parents with Parkinson's, children with learning disabilities. We've used neonatal care for our children. We've got relatives with eating disorders. And just like the rest of the population, we've seen the NHS at its worst, but also at its absolute best. And there's lots of speculation about what we can learn from other sectors, but I think that there's stuff that we can talk about and talk up as well. I don't know if people have seen this slide before, but this is just showing about what the British public said that they're most proud of. And right at the top of that list, you've got the NHS. By the way, this was in 2012, the year of the Olympics, the year of the Jubilee coming in, and we've got the NHS coming out above things like Armed Forces, Team GB, and the monarchy. And that warms the heart, doesn't it, in when we look at it like that. It's, you sort of see that, and you can say, well, why is it there? I don't think it's there by accident or because the NHS is a well-loved institution. If that was the case, after 65 years, I think it would have been found out. It's there, I think, because people have seen it and used it at its best. It's the sort of stories that they tell us about. And all those stories involve members of staff and the support and the compassion that they receive from that. So that sort of thing sort of warms my heart and sort of keeps me going and says that we've got something that's worth preserving and something that's worth investing in and something that we can do to make better. We can look at Francis and have a look about how we improve things. It's things like that keep you going. But it's also a very sort of personal thing for people involved in the NHS. I became a granddad this year. So this is my grandson, Bobby. I know, I'm from the north of England, I say. People thought I was on the shelf. I know I don't look old enough, but people thought I'd left it too late to become a granddad. I want an NHS. So the things that I do is for an NHS that's going to be there for him when he's older and he can be part of as well, that he has something that's going to be there to look after him and his families in the future. And that's why I want to get these sorts of things right. But this isn't about complacency about all of that. I think that we've got to reverse the sort of concept that's developed up. Over the last year, what we've done is try to get our organisations and the staff in them to be sort of organisational managers. How can we marshal using the staff to deliver some targets? How can we get our staff to serve organisations for those targets? And that might have been the right approach for the last decade or so, but we've got to reverse that now. We have to say, how can we, as organisations, serve our staff so that they can deliver for patients? To reverse that, how can we, as organisations, serve our staff? How can we show them that they're valued and appreciated? And I'm sure that there'll be things about numbers and ratios and regulation that's important, but I think we can also show that we're interested in the standards that they hold, the professions they belong to, the contribution that they make to care. And we can do that. I think that's the sort of thing that we want to do in the NHS. And I believe that we've got the environment right now in which we can sort of take that and change that concept round and start to do that. I've come to the end of my time. Thank you very much for listening. It's been a delight to be here with you. Thank you.
Thank you very much.